or anything to your abdomen?
Nope.
Healthy generally?
Yep.
Can I give you a bolster? Are you comfortable with that one?
I'm good.
Okay.
Maybe I'll bring this guy up
Sure.
so I can kind of see.
Sure. And I'm just really sorry for the initial contact of cold hands.
It's all good, man. What goes around comes around. Get my clients with icy cold when they start.
So this is where conduction is nice.
I know.
Steal your heat.
This is when I bring the hot pack in here and just kind of hold it while I'm talking to him a little bit.
Exactly. Yeah.
That helps immensely.
So one of the things I learned was some fascial work where you can come underneath
Okay.
the sacrum by the Psoas. Hi.
There she is.
Hey.
And do just a gentle hold. And you can kind of assess the breathing. This is a kind of a nice way to start too. And with fascial work, this particular fascial work that I learned is really kind of, even though the pressure is superficial, it's almost picturing like a glacier underneath your hands, where you're on the surface, but the connective tissue really runs down to your other hand. When you do that, sometimes you'll feel like your hand is almost like glued, where you're like, you can't pull it away. It's pretty amazing. And you know, you can kind of engage, like I can push in just a little bit more just to kind of get through the skin, but really it's like starting to just feel, is there any movement through that area?
Your bottom hand's just hanging on, and your top hand's kind of doing the movement, or no?
It's both, really.
Okay.
I mean, you're really kind of connecting around the entire fascial system through this area. And if you're patient and you kind of just pay close attention, while your bottom hand isn't going to physically move a whole lot, you can feel movement happening. It's pretty neat. And this is like a great introduction for people for abdominal work, especially if they happen to have scar tissue through here. And you can, in fact, just place your hands on either end of the scar, fingertips, and just do a small compression in. So it's almost like an indirect fascial technique where you're trying to just get that tissue to lift.
You're just like pinching inwards towards the center.
So it would be like I'm trying to, here's the scar, which is two hooks. I'm squeezing them together like that,
Okay.
so that when I release, hopefully there's more movement and mobility there. That's what you want to picture with any type of indirect technique, you know, even if I'm doing something like this. Let's say they're really sensitive through here, the belly button's sensitive, or a spot where they're like, don't go near that.
Yeah.
Right, well, what I could instead do is just engage slightly toward each other and just allow that to just pick up and start moving. And any movement that's occurring in my hands, like coming together right now, is his tissue releasing. It's not me forcing it. I just kind of found the end barrier and I'm holding it. And you might feel like the upper hand will move faster than the lower hand. Client might feel more pulling from one end to the other. And this is also really cool to kind of just sit and feel the abdominal aorta pumping. Sometimes you can feel digestive movement occurring, or the client's stomach will start to make a lot of noise as like that fascia starts moving.
Yeah.
Yeah, I ate not too long ago. By the way.
Sure. So are you experiencing anything like kind of as I hold here that you're aware of?
It's my aortic pulse, but I just feel that when I lie on my back usually.
Obviously, another option to do here is to really like torque the fascia, or you can take it in different angles. What I like to do is actually kind of come over the rib cage and the hip, and just kind of pull and lift up. So I can just see, is there much glide over the rib cage here? If you want to engage just a small change. You know, it's just much quieter, more subtle work, but it usually feels really nice, very relaxing. usually pretty kind of slow in trying to initiate some skin rolling.
Mm-hmm.
And it's just to see as I come over the rib cage what kind of mobility I have there. If I'm dealing with a female and the towel comes to about here, right, you can always create a border with one hand, kind of keep working with the other, or you can come up and do a pull this way. You know, it's just kind of working with women's breast tissue, just being cautious a little bit more there, but typically not too much of an issue. And like, for example, organ skin is really pliable and mobile, but on a lot of people you'll find like you can't pick up, right? So maybe that's where you do a very specific indirect.
Okay.
And then once you get a lift, just kind of torquing in that, creating a little bit of movement there. And then checking over rectus abdominis. And then if I want to come lower on the abdomen, you know, just being careful of my hand placement. I mean, you can come very low. And in fact, if I wanted to, I could create a pull all the way down to the pubic bone without even coming below the sheet. All I'm doing is engaging, pulling up the skin this way. And I actually do that quite a bit, just to kind of get that tissue over the front of the hip opened up too. You can also come in underneath and do the same thing. All I'm doing is compressing slightly and lifting. And then just patience, you know. It doesn't always have to be this rhythmic, right?
I think for this area especially, you don't want to shake too much.
Yeah.
For
You want to be gentle. And a lot of people just store a lot of emotion here too. So being really kind of aware and comforting in your touch is really important.
So are there any like particular ways you want to direct the fascia, or just depend on what the client presents?
It depends. Typically, if you see that they are anteriorly tilted, right, that fascia's dropped down, they're hyperlordotic, it's really easy to slip your hand under their low back. I'm going to lift up. And the whole idea is to kind of like pull at the pubic bone and kind of get this area down again.
Right.
The rib cage, you can, will also kind of be dropped down and forward. So everything is kind of up and out in this manner. If someone though has more of like a posterior tilt, really flattened out back, they may also be hyperkyphotic, but you really kind of have to look here.
Right.
That is where I might direct it intentionally inferiorly.
Right.
Okay. Otherwise, the thought is more just mobility between the layers is kind of what I tend to work more at that level.
Okay.
So some of the other things you can do, like that push-pull technique. Have you guys done that?
I don't think so.
No.
Okay, so this push-pull is to get mobility in the rectus abdominis. So if there's a lot of rigidity or tension there, this just kind of bows the muscle ends, right? Because it originates at the pubic bone and then inserts up here. So kind of creating this push-pull this way creates a little tension at both ends and creates some length in that muscle.
So digging and stripping through.
Yeah.
That's cool.
And then you can also get very, very specific here, right over the surface of that linea alba. And this is where some people will feel like something's all weird there. Like it can trigger kind of just a painful response too. So you do want to work kind of light it first, and if they can handle it, you can kind of go in there a little bit.
Do you feel like little nodules there? Do you will feel like a little...
Like, and even more to the left or right, depending on if the rectus abdominis is stronger from one into there. So right about here, I feel like there's just a little bit of change in the tissue. Maybe like a tiny bit of a nodule. I don't know if it's uncomfortable for you or not. And then what you can also do is like a real specific torque.
Mm.
So it doesn't feel like it's lifting very well. Just kind of coming in and doing a specific twist.
How's that feel?
Good.
We actually learned a very deep one. You do basically, they call it a keyhole walk around the whole belly button. Just hitting. They have the number, anything multiples of 9, like or 6, is a significant number for the Mayans. So every technique they say to do it 6 times. So each circle is like but you know, it's in terms of it's very adaptive to any technique you use. So even just coming around this way.
Do you have to do it clockwise too?
No.
Okay.
They do work clockwise, but something this specific, no.
Okay.
I mean, if I was doing really big sweeping
Yeah.
stuff, and you know you're going over the colon,
Mm-hmm.
yeah, think about moving stuff in that direction. So what they would do is they would find where the biggest kind of restriction was through here, which for him, to me, it feels like it becomes a little rigid here. I don't know if you feel a difference. I'm not pushing super hard
Mhm.
for this. But what they would do is work with the breath. So you can breathe in, and as he exhales, he'll sink in.
The torque.
And oftentimes you'll feel the abdominal aorta, and normally they say, like, get off of that.
Yeah.
They don't in this technique. They just hold there, twist it a little more as it releases. And then they come out of it.
So
I'm not holding it for 5 minutes.
Right.
You can feel it. And they'll do that a few times.
Okay.
Okay. But some really easily, like, adaptable, adaptable techniques that we do there. So, for example, of course, like when I put lotion on, it's in this way. But you can also swoop down. You can do the thumb stretch around the rib cage. So, you know, Sarah kind of had you walking underneath there.
Mhm.
You can do the same thing. I mean, you can really kind of do any technique you want. I'm just not grasping so hard. But just trying to get some opening here. You can also assess, like, are the ribs level left to right? His left protrudes more than his right. Can you see that just a little bit?
Mm-hmm.
So maybe his lungs expand a little bit further into this side. So maybe I want to try to get some engagement here. And if I see that, you know, I can kind of work to open that up a little bit. You can also measure and kind of feel for breathing all the way into the back of the diaphragm as well. So you just ask them to breathe down to your belly. I should feel his ribs push down into my hands, and they don't.
Mm.
It's lifting. So it's showing that he really fills this way, but he should also be filling into the back here. So I could say, next time you breathe in, try and also feel your ribs just settle into my hands. There you go. Better now that I cued it. Much stronger on his left than on his right.
Hmm.
Breathe primarily through my right nostril too. Crosses over.
Make you feel engaged just a little bit more, and sometimes just a little bit of tactile pressure or squeezing in and releasing as you inhale, so you can kind of feel that drop. It's nice. You can also do a rib springing, which is just a real light.
Mm-hmm.
Have you guys done that?
Yeah.
Yes.
Right, where they exhale. They breathe in, you just kind
Yeah.
So that's some nice rib cage work. You can also just kind of do a little bit of like finger scraping, I would call it. That's to get those intercostals.
Do you ever work the intercostals really direct? Okay.
Yeah, I mean, you can go in and work to the attachment on the lower rib
Okay.
and the upper rib.
Okay.
I mean, you can get super specific,
Okay.
especially if they have a complaint of rib pain. Right. So in kind of in the same token as this just round clockwise technique, you can take it from very broad and just start to narrow down your circle.
Kind of like spiraling inward.
And then as you rest, spiral out. I'm still going in the same direction.
Have there ever been any times to go counterclockwise to reduce motility?
Usually if people have like diarrhea or overactive bowel, abdominal massage is just contraindicated, other than maybe like a warm pack, which can actually kind of slow down the slow muscle or smooth muscle kind of activation. So I would say no. I mean, if you're using light pressure, it's fine. You can really go in any direction. But if you're engaging a little bit deeper, or you're pushing beyond and into kind of that space, you want to just be conscious of that. So as you spiral out too, this is where you can maybe kind of come in just to those corners. Just check for any signs of rigidity or discomfort. And if you feel it, it's really just kind of petrissaging it a little bit and then just kind of clearing it out. I'll really only kind of do really targeted work like that if someone has constipation issues or digestive issues. And then something that I, a specific technique that they use in the training I did, which was kind of the central technique that they use. Lotion on because it's kind of a deeper drag, is basically pulling toward the belly button, down here and here. And it was something that I was taught as self-care, which you could teach your own clients as well too. You just have them kind of hook their fingers and create a rake. And they can do it themselves. Right? And they can do this as well. And it's kind of the same thing I use, as just kind of hooking in, creating a wall, sinking in, and lifting. The shorter strokes are on this lower aspect. You don't really need to come above the ASIS too much. But you can come to the corner, lift. Go that corner and lift. And they would have you repeat this 3 times in each spot. 9 times for a total of 27 strokes. But this is just a little bit deeper pressure, and you can check in. It shouldn't be painful. It might feel like deep, but it shouldn't be painful or invasive. But like, for example, on him here, just definitely getting some movement in his digestive system, and also like a little bit of a catch or pulling right through there. You hear that or feel that?
Yeah, like a little click.
Yeah. Right? Yeah. You can almost hear it. Gotcha. Yeah, it's weird. Okay. So, like, when I find something like that, I stop and just kind of...
Is it a ligament?
His inguinal ligament's lower. It's just above that. But it's superficial.
Is it a French fry?
French fry.
We're gonna loose fry.
Rope them in.
Loose fry in the lower right quadrant. Yeah, that's just interesting. So maybe I switched to my fascial technique. And, I'm not trying to move it in any direction. It's like you use your intuition and you listen to the body and follow where it tells you to go, if that makes sense.
Mm-hmm.
And so, like, to me, I'm thinking, I wonder if this has anything to do with
The rib?
less
Yeah.
movement in the rib cage. Who knows? But it's kind of ticking as I stretch it. Like a tick, tick, tick.
Oh.
Feel anything going on there as I do that? Okay. I mean, you can see it pinked up a little bit too.
Mm-hmm.
So something changed. So as I go through there again, it's still there, but not as noticeable. Catches right there.
Mm-hmm.
So, I mean, you understand kind of how, like, my thought process, right?
Yeah.
If I go through and I find something interesting, stop and pay attention to it a
Right.
little bit. So you can do the same thing here. You can hook. Sink. A little more gentle over this area. And some people, right there, you'll
Mhm.
feel the transverse colon.
Awesome.
So this is an awkward body mechanic
Right.
here, where I've gotten accustomed to kind of figuring out how to do it. But if it's not comfortable,
Okay.
you switch what you're doing and move in a different
Okay.
direction.
Just go on the other side of the table too.
Absolutely. Yeah, I can ask if it's okay for me to sit down. I can
Mhm.
work like that. It's a little bit less awkward. So. I didn't really check this rib cage in terms of like comparing it to the right side. There's good pliability there. So I just caught a little. Yeah.
Yeah, I get that a lot actually on this side. A lot of times when we've been working together, and I've been face down, someone's been doing something and face came over and put some pressure on the side. There's like this weird little like catch or like digging in on something.
Mm.
It's only ever on that side in that spot.
Hmm. I mean, and it's interesting, like, this rib in particular is protruded more. You can almost see it if I kind of outline it there. Right there, it's just popped out a little bit more. And that could also be something to check with the articulation to the SPs or TVPs in the back. Is there, like, mid-back tension more so on this side? And I could just kind of do a little bit of rib joint play.
Hmm.
I mean, you could really spend an hour in the abdomen if you wanted to. There's just so much here, you know. And then I actually really like doing joint play here as well. I think you guys have played around with that some too. But you can get into iliacus here. Now, in this case, I would have, if you could pop your right knee up and your foot on the, yep. This puts a lot of slack into the superficial tissue, and that way I could come in and really sink in. And I can also make sure he's nice and relaxed here. Pull him toward me. Kind of create some movement and distraction there as I sink in. And what I'm doing is coming onto the inner surface of the ilium, right? Above the inguinal ligament. It's a lot easier to access that way. And it's a common trigger point site that refers to the lesser trochanter. Any tenderness or anything?
It's tender.
Tolerable?
But it's, yeah.
So, you know, I might just kind of have him breathe into that. You should feel it soften as you exhale.
And if people come in with lower back injuries, that could have something to do with it.
Yeah, for sure. Sorry, you probably can't see what I'm doing. We could do some reciprocal inhibition. Probably be more comfortable doing this from the other side. But I could have him push your leg into my hand to activate his extensors and shut down his flexors. Especially if it's really tender. So you have a good technique. Okay. Push harder so you overpower me. And bring your leg back down to the table. Good. So I'm offering resistance there so that he's not eccentrically contracting his hip flexors to do that or firing them. Feel okay? And you can do the same thing for the psoas. So since we found some catching on that side, I could do it passively. So just want you to relax your leg into my hand. And if someone cannot give you the weight, ask them to push down into my hand with your leg, and then relax out of that. Good. That is an easier way to have someone give you their weight than to just say, like, relax.
Right.
They understand that cue more. If they push and then relax out of something than trying to relax into something, right? So here's a nice way to get psoas. I'm just going to sink in really softly but slowly, and I'm going in firm. And then I'm going to stretch him into extension as I continue pushing superior. Your stomach made a weird noise sound.
What is happy?
I'm pretty sure I put this on vibrate.
You can also use a soft
Guess
fist.
not.
It's okay. And I'm sinking in and doing that to engage with the knuckles. So I'm sink.
What if they have the tendency to like tense up here and push in?
Mhm.
How do you-
Then I work slowly on the exhale. And baby steps. It's like each time they exhale, try and engage just a little bit more. If I feel them tense up, I come back out again. Just try to work at the level where they can stay relaxed. And then my goal is to, each visit, try and get that more. You can also, I think we talked about this one of you, where you hook onto the front of the hip, stretch inferiorly as you hook superiorly. You guys can see how his ASIS has dropped on this side. So you're feeling some out. Are you typically level hip?
as far as I know.
You know? I didn't notice before we started that was too off, so I'm just working around the TFL glute. Kind of as a little breather from the abdominal work.
Yeah.
And then you're in a nice position where you can kind of get in here again. And if you're having trouble pushing in, it's sensitive, or they feel like they're guarding, you can bring this foot up on the table and flex your knee up for me. Good. That way it softens that up again. And I can kind of work into that as well. So it's not always like me moving my hands. Sometimes it's like trying to get the client engaged in the movement. So I really have his whole ilium in my hand. I'm squeezing it pretty firmly. But it shouldn't feel invasive or rough. No? Speak up if it does.
It's tender.
Tender.
Sure.
And I feel some, like, right about there, the tissue quality is a little different. Just have more time working right in that area.
It's this spot.
Okay, let's just breathe down into that. Feel it soften. Warm. And sometimes just contact elsewhere is a good distraction.
Mm-hmm.
And if I wanted to, say, bring him more into my thumb, I could also pull him this way a little bit. And then I can have him push down into my hand. Good. And then slowly push your leg down to the table. And again, I'm giving him resistance there so that it's his extensors working, not his flexors.
Hmm.
Good, relax. So, I mean, you know, this is me getting super specific and doing muscle release. And you can take it that far if you want, or you can stick with getting the superficial tissue really moving. It's what you find. I mean, it's really working with the layers. He was really pliable superficially, so I explored deeper.
Mm-hmm.
Right? You can do lateral pushing too. You can do medial compressions. I'm doing that with my hands. And I always get low to do that so that you're not pinching into them and you're really not using a ton of strength to do that. This is good for the SI joint flaring.
Hello.
Oh, yeah. Didn't really need this sheet, did we? Bring them up. Sink in. Stretch down. Stretch up. A little bit deeper. Almost level again. Right, this was a lot lower. That's a lot more open. Did it have an impact on the ribs? Still not quite as, yeah, a little more flared here. So I might have him, while I compress down here, breathe into this side. See how it's opening up nicely there. Again. Breathe back into my hands again. Filling up much more nicely now in the back side. That's a more full engagement of the diaphragm. And then it's something he can do himself as practice by just resting his hands here to one side where you can kind of reach behind. If it's comfortable, and focus that. One other thing we learned was just some opening of the lymph nodes in the groin. This is nice. You can also do some really light strokes here in the inner thighs. Following that work, it just helps kind of open up the channels in the lower legs, help that kind of return of venous flow, pumping out our aortic flow. And then a lot of times after this type of work, clients, when they get up, feel different in their legs. They feel much lighter, feel warmer, they feel like there's blood flow going through.
Really?
Pretty amazing. So you see people with like the swollen ankles and just that chronic kind of pooling, open up their abdomen. And then teach them to do it at home. There's a bunch of stuff to do that is associated with this work on the backside. Maybe explore some of that next time.
Yeah.
Cool.
Okay.
Thank you.
Thanks.